You know that scene in a movie when someone gets released from prison, they walk out the gates, the sun is shining on their face, they take that huge breath of air that is just freedom entering their body. That's how I felt leaving the hospital that day. After 33 days, I've been in there. I am wheeled out in a chair by Nurse Alicia, and I get in the car and just begin crying harder than I have ever sobbed in my entire life.
And that's saying a lot for you.
That is saying a lot for me.
Were these happy tears?
They were every kind of tear. I was just so happy that the sun was shining on my face. I was relieved to be out of there. I was worried about the future. Have you ever felt every single emotion hitting you in the exact same time? Your body doesn't know what to do. So I just started shaking uncontrollably as I sobbed. And I remember you had to tell me, you need to breathe, because I was crying so hard.
I was literally worried we were just gonna have to turn back around and go back to the hospital because you weren't breathing.
Right, but then here's the thing. Yes, I'm out of the hospital now, but now our new reality sets in of we had basically had to bring the hospital home with us because we need to keep me alive through antibiotics. So within 3 hours of us being home, now there is a medical professional teaching you how to use this little tiny computer that is going to feed me antibiotics multiple times a day. And basically now we are putting my life in your hands.
No pressure or anything. Just like don't miss a dose or your husband will die.
So naturally, we decide that night to go to Mike and Jess's holiday party. I haven't been out of the hospital in a while. I feel okay.
Yeah, why not run out to a party?
Yeah, and plus Sam and Jen are there. So we figure, okay, this is okay. So picture this. I am hobbling into Mike and Jess's apartment on crutches. Everything is going okay. I'm seeing friends. They were all so happy to see me. But then all of a sudden, all hell breaks loose. This little machine will not stop beeping. We don't know what's wrong with it. That feels like a good place to start, huh?
Yeah.
Hi, I'm Alex Hooper.
And I'm Lauren Tassi. Welcome to Hopefully Kidding, where our family planning journey hits yet another medical speed bump.
Let's go ahead and do a quick little recap of the first few episodes. We got married. I got stage 3 Hodgkin's lymphoma. We had a miscarriage. And when we last left off, I was in the hospital with sepsis, and my dad had just died.
Yes. So we're still in the hospital. Let's back up a little bit and explain sort of the situation with your dad.
Yeah. My dad, was a stalwart of his health. He never really wanted to tell us what was really going on with him. He was I'm fine, don't worry about me type of guy. But over the last year, things had gotten a little touchy. He was on dialysis. He almost didn't come to our wedding because of that. It was this huge fight because he was like, Alex, I don't think I'm going to be able to do it. There's no way I'm going to be able to get my dialysis equipment on a plane. And I would not take no for an answer in this situation. My sister, as we've said, is a medical professional. She's a nurse practitioner. Her and I went through all of the necessary research to figure out how we can get this dialysis equipment to Mexico to get my dad there safely. And we did it. We got him there. And I'm so glad we did because, first of all, my dad hadn't taken a real vacation in I don't know how many years. And he just needed to be there for this moment. And he definitely had a great time. Yes, he was a little weaker. Like at one point, he got a massage on the beach and we had to walk him out there. And even that walk was a little far for him. But he was able to put on his Sunday best, get in a nice suit and watch us get married. And that was very special for me. And I didn't realize that was the last time I was ever going to see him.
Yeah. I mean, you had talked to him a few days before, right?
Yeah. I mean, that's the problem with somebody who always goes, I'm fine, don't worry about me, is he knows how to put on this air of everything is okay. So when I talked to him and I was in the hospital, he sounded all right. And he'll always say, my doctor says my cholesterol's better than his. Like, I'm doing great. Don't worry about me. And I guess like a couple days before the day before we couldn't get a hold of him. So we started to get a little concerned. I was calling him. My sister was calling him. And then she did a medical check. Is that what they call it? When
A welfare
A
check?
welfare check. Yeah, they did a welfare check. And I guess that's when, the police went over there and they found him. And so I had just gotten a call saying, Dad's dead. My sister called me and said, Dad's dead. And here I am in the hospital, just trying to sort through all of my own shit, our own shit. And now on top of this, and you just start to think, like you said, what the fuck is happening?
That was just that moment. I was just like, the universe is playing some joke on us, that was really hard.
You start to wonder if you did something horrible and didn't remember it, like you blacked out. Like, oh, well, I drove a car on ketamine and ran into a school bus full of children and the bus exploded and they all died. But I guess no one ever told me about that, so everything's fine. Because how are so many traumatic events happening to us in such a short window? Since I've been diagnosed, it has been less than 4 months. And we have now had cancer diagnosis, miscarriage, sepsis, strokes. I'm in the hospital. Now my dad is dead? Fuck us, dude.
Yeah. Like, how do you even deal with all of these crises at once? It's not surprising that we needed a couple years to deal with all of this afterwards.
Yeah, I mean,
there's a reason we didn't do this podcast right away.
the answer is you don't deal with it, because even with my dad's death, I remember, yes, I'm going to cry a whole lot, but immediately it's like, oh, Alex, you got to go do physical therapy. You have to get yourself out of this fucking hospital. So you just push it down and you go, okay, call my brothers, call my sister, call my mom, talk to everybody, make sure everybody else is like on the same, all doing okay in this. But now I have to go back to my own world of me being in this hospital.
Yeah, I was in therapy at the time and I was still taking my appointments. I was literally going into my car and doing it on my phone in the parking garage. And it was like every week I would go see my therapist and tell her like another thing that had happened. And even she was like, this is crazy what you're dealing with,
Can I ask you a question?
Yeah.
Did I drink that Frappuccino though?
You absolutely did. You know you did.
I can just imagine me, my dad is dead. Mocha chip. That's so good.
I think this is a great transition to the next day when your mood changes a little bit, totally understandably. The orthopedic surgeon comes in the next day and basically says, you're not going home, because we had been told you were getting ready for discharge. The day your dad died, it was like within the next day or two, you were going to get discharged. But the surgeon comes in and says, we need to do surgery. We need to put drains in your knee to get this infection out of your knee. You're not going home. You're getting kicked out of the rehab unit and you're getting put on another floor in this hospital.
Yeah, he basically told me that I was going to be there another 4 to 5 days, which you got to be fucking with me again. Like, because now on top of already having been there, not having been outside, all of these horrible things, now my dad is dead. I can't even fly home to see my family or be with them in any way. Now I have to stay in this fucking prison for a longer time because I need a surgery. God fucking damn it. Like, what do I need to do to get out of here? When am I going to get out of here?
It was super frustrating. I remember I went and got you sushi, right? There was like a rather nice grocery store you could walk to from the hospital. I spent quite a bit of time there, considering it's clear that like I use food to comfort myself and others.
We got to know that, you got to know that Pavilions very well.
Yeah. So I went and got you sushi from Pavilions, and then you basically flipped on me.
I feel really bad about this. I just remember going like, I think I just said, God, this fucking sushi sucks. And I smashed it or something.
Yeah.
It wasn't anything against you. You didn't deserve it. And I didn't know how to emote at that time properly. Like too many things were going on inside of my brain and my body for me to react in any sort of normal way. And that was the first time I had done anything other than be extremely gracious and kind to you for that entire month, because you'd been there every single day. You'd gone out of your way to be there with me. And that's when you were like, I'm fucking leaving. I don't deserve this shit. And I was like, good, go, leave. And I did call you that night, right?
For sure. I also think we need to like back up and mention that like you are no sushi connoisseur, right? Like you will eat any grocery store sushi.
I'll eat 7-Eleven sushi. Yeah, I don't give a fuck.
So that was the irony of it all, is that you were just like pissed off about this grocery store sushi, but in any normal circumstance, you'll eat the worst sushi. But yes, you called me, you apologized, we worked through it. We're over it. This is also when I think Sam probably reached out to me first, to your brother Sam, about coming down to see you. And I was like, yes, please. Oh my God, please come and help us.
Yeah, my brother and his wife live in Alaska. They work for the park services up there. And he called me and I was like, are you sure you want to come down here? He's like, and I remember him saying, he's like, Alex, I need to be with you right now too. Like our dad died and my sister lives in Virginia. My brother lives in Alaska. We can't all be together. There's not going to be an immediate funeral of any kind. I need to go down there and I need to be with somebody that I know that I can be like in this time. Not only are you going through something, but now he's going through something too. And he was able to take the time off work, him and his wife. They flew down immediately. They were there, I think like a day later or 2 days later.
It's not easy from Alaska.
No. And I'm so grateful that he came, because also my brother hates LA. He really, this is not, he does not like cities. He is a mountain man, and LA is everything he hates about, of the way people live, essentially. So for him to come down here and be like, yes, I am going to get an Airbnb. We're going to spend a few days with you in the hospital. We just needed to be together. And I'm so glad he did, because also now I know I'm going to get this surgery. So my recovery is not just like I need to rebuild strength. It's you're going to be pretty much crippled for the next few weeks.
Yeah. So while Sam and Jen are on their way to LA, you get transferred back to the regular hospital. Oh my God, it was so terrible having to go back there. And they
so like no more acute rehab, right?
Yeah, like the acute rehab floor was much more chill, right? Less screaming. I mean, maybe there was occasional screaming from like people being in pain, but like less like tortured screaming. So you're back in the regular hospital. No one is happy about this, that you get the surgery. It's a minor surgery. They just put these drains in your knee. You had to wait a couple days and then they took them out. So it was just an inconvenience at this point.
Yeah, I mean, I still got a dose of fentanyl to put me out and everything. So in my opinion, fentanyl is great, by the way. I don't know what everybody is raging about. But yeah, I got the surgery. And then I remember like they had to stick these tubes out of my knee. They went into my knee that would drain fluid out of them all day. So you could physically see stuff, this yellowish, weird, chunky substance just coming out of myself all day. And they said it's going to be 3 or 4 days of just that. And so now here I am, not leaving this hospital, can't do physical therapy anymore because now I've got a knee issue. I was asking the surgeon, hey, what's my recovery going to look like? And when can I play tennis again? Because that's all I wanted to be able to do, is get healthy enough and get back on the court. That's my form of exercise. And he goes, oh, you'll never play tennis again. You can't play tennis ever. And look, say whatever you want to me. If you tell me I can't do something, especially in the physical world, you have just said the wrong thing to me. If this doctor had said, listen, I don't advise it. However, with enough strength training, conditioning, patience, that in a certain amount of time, if you go really slowly, you will be able to play tennis again. As soon as he said, you're never going to play again, I was like, fuck you. Watch this. I will show you what's up. And that became my mission immediately.
So you have the surgery. They put the drains in. It's all looking good. They're like, all right, we got to get the okay from the surgeon, and then we'll take the drains out, and then you can go home. And we finally get that day. Sam and Jen are there those last few days you're in the hospital. and we're getting ready to have you discharged. And I'm still struggling with these feelings of like, oh my gosh, I'm going to be in charge again. I'm going to be the one that has to make the decisions. And if something goes wrong, like when do we go to the emergency room? Knowing that you're going to have these IV antibiotics, that I'm really going to have to become your nurse over the next few weeks. So I'm really dealing with this mix of emotions of like the joy of getting you out of the hospital and not having to go there and just getting you home, and like, oh, that was so relieving, but then it's all on me again.
Right. But before I left, I also had to get a PICC line.
Yes.
Right. Because also, so now they're not going to put a chemo port back in because, well, I don't want to get sepsis again. So now they're going to do a PICC line, which is pretty traditional, which what most cancer patients get if you're going to do short-term chemotherapy, mainly because it's exposed. You have to keep it very clean. There's much higher chance of infection with a PICC line than there is with a port. So I had to get a PICC line installed in my arm, and what they're using it for now, before I can go back into chemo, is I have to do intravenous antibiotics 6 times a day. I have to wear this fanny pack that keeps them in there that has this little computer in it, and that gets attached to my PICC line. And Lauren is the one that needs to change the pack multiple times a day while I'm at home, and it needs to be changed every 4 hours. It is 6 times a day that this thing needs to. Isn't that right?
No, it only the bag of medication only had to be changed once a day, but it was on a cycle where it would give you meds every 4 hours.
That's what it was. Okay, but you had to be the one in charge of changing the bag and making sure this little computer was doing what it was supposed to do.
So you've got the PICC line. They're also giving us all this equipment, right? They send us home with crutches, a wheelchair, a bedside commode. They were like, and I'm just thinking, oh my God, he's not gonna be able to move. I'm gonna have to help him go to the bathroom. Like, it just really preparing myself for a lot to deal with medically and not knowing how soon he'd recover, if ever, really. I believed in him and his determination through it, but the hospital is preparing me for a pretty dire situation.
That's one of the scariest parts to me is like, this was months later, but I remember Holly, your sister, saying to me like, it's really good to have you back, Alex. And I was like, what do you mean have me back? And she goes, we weren't sure if this version of you was ever going to come back. The version that is always joking and positive and in a good mood, like you. And I didn't know really what she meant by that, but I remember that really affecting me because this is the time when you're saying like, we don't know what version is going to be on the other side of all this trauma that has just happened to you, your body, your brain, everything is adding up for the worse. So, man, yeah, this is a scary time for you indeed, scary time for me too, having to go back home.
Yeah, they sent us home with all this equipment and just like a sack of medication and painkillers and muscle relaxers and all the things. And then they kick us out of the hospital. And that moment was great and terrifying and so many feelings.
Yeah, I do remember coming home and eating a lot of cereal. You had Cocoa Puffs and like Kicks for me or something like that.
Oh, yes. Also in the theme of comforting through food, I was like, I'm going to just stock the kitchen with whatever you want. So we leave the hospital. He has the emotional situation in the car ride on the way home, and we get home and you're reunited with the pugs.
Oh my God, what a moment. Jesus. I mean, one of the hardest parts about me being in the hospital was being away from our 2 pugs, Carlton and Kimchi. Not being able to see them. I thought about them a lot. I kept a stuffed pug in my hospital room, and it was so difficult to not have them. And I remember walking through the door, I was just thinking about this moment for so long. And when they saw me, they looked so confused. There was this immediate like, what? With this guy? Wait a minute. I think they had probably accepted we're never going to see him again. Like, am I even a memory anymore? But I walked in and there was this, and Carlton was the first one. He was like, bah! And ran up, and Kimchi was right behind him. And I mean, whatever position I could get in, like I couldn't squat obviously or anything. Like I was still pretty broken at that point. But I just remember just the beautiful relief of seeing these two little creatures. It was just like my heart just exploded. It was so wonderful.
At the same time, the home health nurse is on his way to our house because Alex had 4 hours in between the moment they wheeled him out of the hospital and to when he needed his next antibiotic dose. So we were like on the clock. Not only did the home health nurse need to come and show me how it works, clean out your PICC line, we also were waiting on the medication to be delivered from the company that was sending us the meds to use at home. So it was a lot of coordination. We live in Hollywood. Parking is terrible here. So that was always an issue with, helping people find how to park, buzzing them into the building. But finally the nurse comes. He very quickly shows me how it all works. Of course, I have no idea. Basically realize I'm going to be Googling this later on.
Wait, you've never flushed a PICC line before to make sure that I can properly get medication?
I had not.
Wow. What have you been doing with your life?
Yeah. The irony of it all is it was really pretty great training for all the fertility stuff to come.
Yeah. We had no idea how much training there would be in there.
Yeah. So we get home, we got the meds, we got you hooked up to your fanny pack. We're feeling good. I don't have to change the thing for 24 hours. Like, let's go out. Let's do something. Right?
Yeah, let's hit the town. Sure, let's go burn a bar crawl through Hollywood. No, where we were going is, and we didn't think we were going to go, but Mike and Jess were having a holiday party that night, and I had been encouraging you to go because I was saying, like, you get out, I'm fine, I'll be okay. But it got to the point when you didn't really want to leave me, and so we just started talking about, well, look, Sam and Jen are in town. They will want to see friends. Like they know all these people from the wedding, and they all love the two of them. So I think as a foursome, we can go to this event and be okay. Right?
Yeah, exactly. And we got you in. All you had to do was sit there, right? No one expected you to tap dance. It was just, let's go sit, let's see some friends. We'll leave when we need to.
And I was really excited to see people because, well, many of them had visited me in the hospital. But again, that's no way to actually spend time with people. You're just sitting there, I'm laying in a bed while they're sitting next to me. And I wanted them to see me out again, like not in a hospital gown, wearing clothing.
Yeah. So we get to Mike and Jess's, we sit down, we're casually chilling. It was a very casual hangout type of party. And then we're there for an hour, maybe 2 hours, and all of a sudden your little fanny pack starts beeping like crazy.
Beep, beep, beep.
And I'm just like, no, shouldn't be happening. No, like it's supposed to be fine. And then I'm like, oh, the tube's coiled. We got to undo the tube so the medicine can get through. No dice, not working. Luckily, our friend Ryan, who's a nurse, was there at the time. And she was like, oh my God, she could actually I don't know what we would have done if she hadn't been there.
Gone back to the hospital?
Yeah. She was like, I think you just need to flush the line. I might even have like the thing in my car to go do it. Like she did not have the thing in the car. What I learned in that moment was that I should have packed all the little tools, the little things you need to maintain a PICC line and take it with you everywhere. Because if I had, we would have been able to just fix it and we wouldn't have had to then drive home with your thing beeping like crazy for 40 minutes.
Very much like when you have a baby, you bring diapers and you bring wipes and things like that.
Yeah.
At that point, I am a baby. Like, right?
I guess so.
Yeah. I need to be taken care of. I need all these things.
So that was a harsh reality of what your medical care was going to be like for the next few weeks.
Yeah, because we rushed home and we knew I was going to be fine. Like Ryan had convinced us. So she's like, just go home. You will be okay, but you do need to flush this thing and get it moving again so you can get your next dose.
Yeah. So now we're home for a couple days and it's the reality of what life is going to be. Sam and Jen were with us for a couple days, which was great. Just hang out with them. They helped with the dogs. Like it was just great for them to be here. But then it sort of got to a point where it's like, I think we're okay. I think we have to manage this on our own.
Yeah, and they had to get back to their lives as well. It was beautiful, especially with my dad's death, to be able to grieve together and talk about it and just to have them there for just basic helpfulness. And, we were there for them too, because, my brother is also, and sister-in-law are also grieving this loss. So to be together for that time was necessary and very special.
Yeah. So now we're just living life at home with your bag.
My bag. Dude, it's the two of us, 2 dogs, and a bag.
Showering was challenging. Like, I would say it was the first couple times you didn't want to do it because it was so painful, and it was getting your leg over the.
Yeah. Well, because I couldn't bend my leg at all yet. So to get my leg over the tub, I would have to, we moved the bedside commode into the bathroom. I never end up using it for anything other than basically just leverage to like put my hands on, lean my weight on so I could get into the tub and just sit on the edge and be able to put my leg out just to give myself a basic wash. Because the nurses had like done a few like rubs on me, like, baths in bed baths basically and beyond, bed bath and beyond. But I had only taken 1 shower the entire time I was in there because I was in such a weakened state that if they were like, well, do you want a shower? I'd just be like, no, can you just like take a cloth and wash me? And that ended up being the status quo for a long time. So even showering here, I knew I had to do it. I didn't want to be a smelly bitch, but it was just scary to like have to know what was going to happen every time.
And your bag kept getting caught on things.
Oh my God. Yeah. The bag, it had all these tubes sticking out from my PICC line to the fanny pack. Sometimes I would just go to get something out of a drawer and I'd walk out of the kitchen and all of a sudden I would just feel this tugging and I'd be like, oh shit. And realize that it had gotten caught on the handle of a drawer. And so I constantly had to be aware of this thing. Even sleeping, I had to hang the bag on the edge of the bedpost. And then I had to make sure that I stayed very still at night so I wasn't tossing and turning because you could very easily just rip the thing out of your PICC line. It was a very tender time for me, and I'm a rough person in my movements and things like that. I can be very gentle and very soft, but as far as my movements go, I make a lot of erratic things. I'm very animated. So me and this bag were not friends. We did not like each other.
So you were discharged from the hospital on December 17th. Thankfully, in time for Christmas. It was definitely a concern at one point. We had spent Thanksgiving in the hospital. I did not want to do Christmas there. So I was very grateful to have you home. I had decorated the house. I was baking all the things, just really like enjoying the coziness of being at home. At the same time that you were in the hospital, my mom was moving to Los Angeles. She had been here in October or November and found an apartment and rented it. This had been a long time coming, her plan to move out here. Both my sisters live here. It makes a lot of sense. But literally the entire time you were in the hospital, she's packing up her entire life, the house I grew up in Ohio, and she's then going to drive across country with her dog to come move to Los Angeles. And she gets here the day after you got out of the hospital.
The day after. She's like, I'm in Los Angeles. I'm in Santa Monica. And I'm just like, I'm home. Thank God. And like, we were having her and I were having very different experiences.
Yeah. She was so excited to be here. And, we'd just been through this like, one of the darkest periods of our life. So it was a Christmas that we were all kind of celebrating in different ways.
Yeah, we're still in hell. We just happen to have left the inferno, and now we're just on the edge, still with a lot of heat coming down on us. We're just not physically on fire anymore. The devil's not poking us constantly.
Yeah, so we get through the holidays, and you're still on the bag. You've still got the IV in. You're going to see your oncologist once a week. We don't know when you're starting chemo again. All these home health people are now rotating through our door every day. And you really never knew what we were going to get when it comes to physical therapy, occupational therapy, or a nurse.
It was like 4 times a week somebody was coming, wasn't it?
Yeah. I mean, I think it was like every day just because you needed the physical therapy. Insurance was paying for it. So I wanted you to get it, and none of us wanted to have to take you somewhere to get the physical therapy done because getting you in a car was hard. Like it was just, you were able to like hobble around the apartment. But anything more than that was too difficult. And so there were just some of these home health nurses, and, I thank them for their service, but maybe they would be better off in a hospital because this one came in, and maybe you shouldn't be a home health nurse if you're afraid of dogs. Maybe you should let your patients know, like, okay, cats only, or let's set up a system for this, because this one woman walked into our apartment, and I will say at the time, Carlton was even in a bedroom. We know he's a lot of energy. We put him in the bedroom anytime a home health nurse came.
Yeah, because Carlton also, he did not understand that this person is here to help us. So he would just be all over them, not in a negative way, like not in a bitey way or anything. He just was like, oh, you're here to play with me. Clearly, that's the reason why this person has showed up at our door with all of this fun stuff. Like, he's here for me. So Carlton would never leave us alone. And this woman had called beforehand and said, do you have a dog? And we were like, yes, but we'll put them away. It's fine. And she was like, okay, make sure they're away. So Carlton is in the bedroom. Meanwhile, we leave Kimchi out sleeping in her bed.
Kimchi is 12 years old. She's a pug. She moves slightly faster than a turtle. Like, she just does not have a speed to her. She also at that time was probably a little bit deaf. Like, we'd walk in the house and she'd still be sleeping. She wouldn't hear us. Like, she's just like a sweet old pug that doesn't move very quickly. What happened when this woman walked into our apartment?
So the chillest little pug in the world, the most zen, beautiful creature, is sleeping in her bed. This woman, who I think was from like Eastern Europe or something like that, she walks in the door, with this bag of equipment, and she sees Kimchi sleeping in her bed and just starts screaming. And she's like, no, I told you no dogs, no. And I was like, this is Kimchi. No, she's not going to do anything. She's asleep. She's the sweetest little thing. She's like, no. And I went and grabbed at the speed I could move. And I had to be like, okay, we're going to get her out of here. And I don't even think I was able to pick her up at the time because I don't think I could bend down.
Yeah.
I don't remember how we got her into your office, but the fact this woman, I mean, you would have thought she saw a fucking dinosaur, like ready to attack and claw her face off, the way she reacted to just this 20-pound little plump ball of love. It was just absolutely maniacal. And it was a little uncomfortable for the rest of the session, to say the least. Because that woman was here to change my dressing as well. She was doing more than just like a physical therapy session. She was someone we had never met before because she was here to actually change my PICC line out.
Yeah, I think it got to the point where we were done with the physical therapy. You didn't need that anymore. And we were just having your oncology nurse change out the dressing on your PICC line because the home health stuff was really challenging and stressful. It was literally easier for you to just go to the oncology office where you would go once a week anyway to get that dressing changed. So we're now into January. We're still just like, when do we start chemo? When can we?
Oh, wait. Can we go back real quick?
Yeah.
New Year's.
What was New Year's?
New Year's was when in my sleep, I pulled my PICC line out of my arm.
Oh.
Do you remember this?
I remember this because we went to the emergency room.
We went to the emergency room and because we called the home health nurse who'd been changing my dressing and he goes, send me a picture of how far it's out. And he sent a picture. He goes, oh, that's beyond putting it back in. You got to go to the emergency room right now. And I'm like, it's New Year's Eve. And this is like, our doctor is not going to be there. He's like, that's the only option you have. You got to go to the emergency room. Yeah. So here we are. We had made an agreement. We're like, hey, no more hospitals in 2025 or in 2023. At the end of 2022, we were like, no more hospitals. And so I was like, well, look, technically it's still the last day of 2022, so we can have another hospital visit. We got to go to the ER right now. We go to the ER. And again, you want to get to the front of the line, say, hey, I'm a chemo patient. I've been in here for 33 days this month, and I'm about to miss a dose of my antibiotic because my PICC line has come out of my arm. So fortunately, the doctor or nurse or whoever he was that installed my PICC line happened to be working that day in the hospital, and they knew exactly who it was. They were like, hey, was it Reza who did it? I was like, yes, it was Reza. He was great. And they were like, oh, he's here right now. So he was able to come and actually just redo my PICC line, which, I mean, the stars aligned in that moment because we were able to get out of there just after a few hours with me with a fresh PICC line in my arm. But yep, I was back in the emergency room that night. So now let's get into January.
Yeah. So you actually started going out with your IV bag.
Yeah, that's right. I was strong enough that I could start with, I could hobble, I could walk, I could drive. I remember the first time I drove, our friends Jeff and Dan were like, hey, we're going to go get Ethiopian food. Do you want to come? And I was like, yes, I do. And I had to figure out how to drive a car again. I mean, that first drive there was pretty scary for me because I was still on the bag, but I went there and I was like, okay, if I can go out to get to a restaurant with my friends, maybe I can go to the Comedy Store. And I was a little scared to go because while everyone there at the club knew what I had been going through, they didn't really know the extent of it. Some of them knew that I'd been in the hospital and things because I'd made a couple of videos at that point. But just showing up there in that weakened state, I felt so vulnerable. I was really scared, because people are going to ask, what's this bag for? And I wasn't ready to get on stage because I knew I would have to explain the bag and make jokes out of it, which I didn't want to have to do because it would just be so distracting. But I went to the Comedy Store and I just immediately felt like I was home again. That was my true, getting back to the apartment, being with the dogs was one thing. Getting back to the Comedy Store, and seeing all of these people that I've spent years performing with and being around, there was this just major sense of relief and of hope, really, of one day I'll get back to this being my life again. It was really, really nice.
So if you remember back from the worst day of Lauren's life, we had to go get that PET scan, and that PET scan was going to tell us if the chemo was working and if we need to continue, how much more chemo we needed to do. The good news is, and we found this out when you were in the hospital, the PET scan results were great. The chemo was working. It was maybe working better than expected. The doctor, once you started chemo, was going to actually reduce one of the chemo drugs. You were taking 4 at the time, and they reduced it down to 3, considering, everything you'd been through. They didn't think you needed it. We just needed that sign off from the infectious disease specialist that we could go ahead and resume chemo.
Yeah, I needed to be cleared by this one doctor was just waiting. And my oncologist was chomping at the bit. He wanted to get in there immediately. He constantly can we start chemo again? I'd be like, no, this guy's got to clear it. You guys need to work together. I can't be the middleman here all the time. But he really wanted to get back in there because he knew that I had been doing well on chemo before all this happened. So he wants to get back in there.
Yeah, and I was on his side. Let's get going, folks.
Yeah, and then he ended up shortening my treatment as well because originally we thought I was going to have to just start almost all over again or maybe still have to do 8 more treatments because I'd only done 4. And then did I have to do 8? I think he reduced it to 6.
It was basically 2 months. Once you started it was basically 2 months.
So 4 more treatments then. Yeah. So, okay. So we've cut a couple months off because we lost some time there, but I was doing okay.
Right. So after 6 weeks of antibiotics, 1 million blood draws, and weekly checkups, we finally get the news we've been waiting for.
And the infectious disease specialist cleared me. Here we go. I can start chemo again.
Woohoo. And suddenly it's the end of January. We've got 2 months of chemo in front of us. And if everything went according to plan.
But Lauren, nothing in our life has gone according to plan in the past 6 months.
Okay, but we don't have to wait around anymore, right? We're back on track. It's time to get our family planning on the go.
So we called the fertility clinic.
Because after everything we'd been through, cancer, miscarriage, sepsis, losing Alex's dad, we were not giving up on building our family.
Yeah, we just had to figure out how we were going to juggle chemo treatments in between fertility appointments.
And what we learned at that first appointment would change everything.
And you'll find out exactly what that is on the next episode of Hopefully Kidding.